on a calendar. Write them somewhere you can see it so you can reward yourself. And then I started just 1 day a week, and I tracked it over within a year, I was doing so much better. It was just an amazing difference just that 1 day a week. So don't think you have to do this 5 to 7 days a week to get benefits, because you don't. It can be very small. And then one just final point is sometimes you don't have to see that whole staircase. You just need to take that first step. And usually that's the hardest step, I know. That's all I have. Does anybody have any questions for on physical therapy, breathing, exercising, anything like that?
Could you demonstrate the breathing?
Okay, sure. So the easiest way is if you have your hands right here, okay? Let's see if I can do this. And as you inhale, I'm going to really protrude. Your tummy gets bigger.
Okay. So push my tummy out?
Push your tummy out as you inhale, and then as you exhale, it just goes back natural. And as you inhale, it goes back out.
Inhale out.
Exhale in. A lot of us do, if you're breathing here and you're going up like this, that's chest breathing. So a lot of us do work from here. This may still be going out, but if you're coming up like this, you're using those muscles in your neck and your upper trap, which is going to lead into the neck pain and then symptoms down the arms.
And when you say stress in your neck?
Absolutely. And your upper trap is a big stress muscle. We could be sitting at the doctor's office or your posture like this. This is going to get really tight. And I know, like, I've recently gone back to work, and sometimes I'm tired by the end of the day, and I'm like, why? And then I look at my posture, and I'm at the computer like this.
You don't even realize it.
I don't even realize it. And there are days that I'm fine, and I'm like, oh, why do I feel so good today? And it's usually because I've paid attention to my breathing, or I've taught my patients breathing. But at days I'm on the computer more, or days I'm stressed out, sometimes I'll have to stop myself in the middle of the day, and I'm like, I'm breathing all from here. And then the other thing I try and do is, because I have such digestion issues, is before I start lunch, I will try and take 5 minutes to breathe. Because I know if I'm breathing from my chest, I'm stimulating that sympathetic nervous system. That nervous system decreases blood flow to your gut, which means your gut's not going to digest your food as good as it should. So if you're working or you're having a stressful day and then you go to eat and you already have GI issues and you're not breathing properly, it's going to further the problem. So that's just another tip that you can try. So whenever you're stressed, or if you notice, God, my shoulders are kind of hurting, or I'm getting fatigued, stop and pay attention to your breath. And the reason why we tell you to practice it, 5 minutes, we tell our patients 5 minutes, like 3, 4, 5 times a day. That way, that becomes your normal breathing. So when you're in a stressful situation, your body automatically goes into that diaphragmatic breathing. But it's an exercise. It's something you have to practice. And the more you do it, the easier it gets and the more benefits you get. Of all the exercises physical therapists teach their patients, I can't think of a more powerful one. I can't think of a more powerful one that we scleroderma patients can do for our stress levels. I can't think of one we can do better for our lungs. Yes?
This is a comment. Many years ago, on a galaxy far away, I used to be a Bradley childbirth instructor. And Bradley does the diaphragmatic breathing, and it's based on animals. And it's interesting because I know probably 200 women who had a Lamaze baby and didn't find that comforting or an easy way to give birth. and came to Bradley afterward, and I never knew anybody who ever had a Bradley baby who looked for another way to have a baby, because it just relaxes you and calms you, and it's an easy way, it's just a very easy procedure. It's nature's way of doing things.
It is, and it's the most natural way we can breathe, and over time, our bodies just develop into this chest breathing. But it's something that everybody can do, and I have pulmonary fibrosis and pulmonary hypertension. Like I said, I need my medicines, I can't go off them. But if I want to just up it and make myself feel even better, I go back into the diaphragmatic breathing. And it has allowed me to increase my tolerance on the treadmill in all of my exercises. It's like giving your body a natural medicine with no side effects. And it just affects every part of your body, and also for caregivers. You guys are, you know, it's very stressful dealing with us. I mean, we can admit it. And it's good for you to calm yourself down, you know, as well. So, yes.
Just another comment. The toughest thing about all this, even though you know it's all the thing to do, is taking that first step.
It is.
And how do you get that first step? Once you get that first step behind you, the reward for doing that is all those good things that happen. And that should encourage you to take that first step on an everyday basis. And another thing you should do is reinforce your motivation by knowing about these things that you're talking about.
Yeah, and that's an excellent point, and that's why I say is, you know, to write it down so you can do a little calendar and make a goal. I'm going to practice diaphragmatic breathing for 5 minutes daily. Check it off. When you reach your goal, reward yourself something, you know, a trip to a movie, you know, gardening, or do something positive, buy a new CD. And then what happens, what you'll see is that your body's going to start wanting it, and that motivation becomes internal. But until you get that internal, it's okay to use that other motivation because your body's going to want it. But you're right, that first step with anything, with diet, with exercise, with changing your life, you know, it definitely is the hardest. For me, I found that writing it down and checking it off, and that way, you know, if I'm having a really bad day, I'm like, God, my pH is flared up, my digestion's horrible, I just want to stay in bed, I don't want to get out of bed today. Somebody can give me that calendar and go, look how far you've come. And I go, oh. Because even now, I mean, my loved ones, they have to remind me, Tim, you remember where you were, you know, 2 years ago when you were in bed rest and couldn't get out of the bed? Like, oh yeah, huh. So sometimes you have to look back at the journey, and it helps. But definitely, yeah, the first step is the hardest. Yes?
Tammy, would you suggest a pedometer, number one question, but number two, could you suggest breathing exercises when we first wake up in the morning, before we put our feet on the ground, and then anything that we could do at night before we bed?
This diaphragmatic breathing. So
what's that?
Yeah, because that is the basis. Okay. So before you even gotta get out of bed, I would put your hands on your stomach, and that's kind of like a cue. It triggers your body, oh, this is what I'm supposed to be doing. Take 5 minutes and practice it. In the middle of the day, if you're at home or whatever, you're at work, you can close your eyes, practice it, and definitely if you do it at nighttime before you go to sleep, you're gonna sleep a lot better. I definitely recommend, you know, pedometer so you can track to see how far you're walking. I do one when I walk, and that way I know, hey, even if I'm 1/10 of a mile more this week than I was last week, I've made gains. You know, if I went from 1 mile to 1.01 mile, you know what? I'm making gains. And even if I stayed at 1 mile, then you know what? I didn't go backwards. So I definitely suggest that. I also suggest one of those little pulse ox, the little small ones that you have. I actually have one here today. That'll check your heart rate, and it can monitor your O2 stats as you're walking. So definitely those are 2 good tools to have. And the pedometers, you can get them at the Dollar Tree for $1. Yes?
This is probably going to sound like a foolish question, but
There are no foolish questions.
do you have a suggestion for any type of chair for people who may work in an office and sit down a lot as far as posture goes? Because that's, I mean, it's easy to go buy an office chair that's 50 or 75 bucks, but I don't know that it's really helping your posture.
Right. I do, like, these chairs are horrible. I do like the chairs. I know I'm going to say that I'm like uncomfortable sitting in them. I do like the chairs that have like that natural, that give you a little curve in the back that's to support your back, because your low back should have a curve. We shouldn't be like this. So I think those are more important, and then also when you're sitting on them and you're doing your computer, it's like your eyes want to be at the distance of the computer, and your knees should be in line with your hips, so it should be like a 90-90. So you want to adjust the seat height is probably more important. But the ones that have the natural, that little outward on the curve, that's probably the best one for you. And then if you don't have it, you don't want to spend the money, what you can do is you can take a towel and roll it up, and you can tape it and place it in the small of your back. And that way, if you're going from different places, you can take the towel with you, and it's a cheap man's version of it. And you can travel with it, and that'll really help it also.
Perfect, thank you.
Someone else had a question? Yes?
Is it more beneficial to take deeper breaths rather than shallow breaths?
Yes, when you're doing the deeper breaths, your lungs are going to expand more with the oxygen. The shallow breaths are more associated with chest breathing, like that, and that's going to increase your heart rate. So you can practice, kind of goes back to your question, you can practice your diaphragmatic breathing by on count, so you can tell yourself, breathe in for 1, 2, breathe out for 1, 2. And as you get better, you can extend how long you do it. Some people who do meditation and are really good in breathing, they can breathe in for a count of 8, they can hold it for 8, and then breathe out for a count of 8. Nowhere near that yet. But even if I just practice, breathe in for 1, 2, hold 1, 2, breathe out 1, 2. And it's a way to calm your body down.
Is there any place in particular you recommend going to buy an oximeter? I mean, can you get a good one at Walgreens? Or
I got mine from CVS with a 20% coupon.
Oh, okay, good.
Yeah, you can get them you can get them from CVS. Mine's a little yellow one, and it's got your heart rate and the O2 sats. I think it was $39.99 with a 20% coupon.
Thank you.
Your thoughts on a toning ball versus a chair?
On a what?
Toning ball. Sitting on a toning ball.
Oh, I love them. That was my chair for a while. I think you have to make sure you have enough core strength to make sure you don't fall off. I probably would recommend it for your normal, person who hasn't training their abdominals, because you can get a little unstable depending on what you're doing it. But it is a good way to change up. So, I mean, I use them, and we use the toning ball, we call them Swiss exercise balls in therapy all the time. I love them.
Tammy, how do you feel about treadmill desks? And then secondly, when you're working on the computer, you do not realize that 2 hours have gone by, then 3, then 4. Would you suggest maybe setting like a timer, get up every 2 hours and walk around? Or?
Yes, we humans are not meant to be sitting down for this long period of time. The body's meant to stay in motion. You should not be sitting down longer than 30 minutes. So what we've done, I've gone into some workplaces with ergonomics, is go in and on your computer, there's a way, I don't know how to do it, but there's a way every 30 minutes it'll come up and tell you to take a break. But you can set your timer on your phone, an alarm clock, a little digital timer every 30 minutes. Just get up, roll your shoulders back, roll your neck. And the biggest complaint I hear from people is I don't have time to do it. I say you don't have time not to do it. And I'm not talking you have to take a long break. You just get up, 1 minute, readjust your posture, and then back down. It doesn't take long. Or go to the bathroom, go get water, go get your coffee, quick. So yes. What was your first question?
Treadmill desk.
I don't like the ones where you're walking on the treadmill while they're, I'm not a proponent for them, just because our brains only have so much things we can focus on. and your posture and your walking can really get funny as you're doing it and start walking the wrong way. Shoulders can come up because you're trying to balance on a moving surface while you're looking at something. Our brains are not designed for that. So I'd rather you spend the time, do your exercise, because exercise is also a way you're supposed to be away from all the technology. And let your body
I'm not that type.
No, but let your body think, about other things. But no, it's a good question because they were out for a while.
Yeah.
What's the name of that chair? Tony?
He called it a toning chair. It's a person.
Toning ball.
Toning ball. It's a Swiss ball or an exercise ball, fitness ball, the big balls. They have them at the gym. Some people, sit on them for computer. Yeah. Yes.
So you're not a fan of at gyms with the treadmills with the TV in front of them, basically?
Well,
Is that what you're saying?
what the treadmill that you're at the gym with the TV in front of you? Oh yeah, I couldn't do a treadmill without it. I think she's talking about the treadmill that they've set them up where you walk on the treadmill while your computer is set up and you can work at the computer while you're walking.
Oh, I've not seen that. I would.
Yeah, some companies have done that. Oh no, to walk at the gym. Oh yeah, I need my TV.
Oh, okay.
No, it's to be working on the computer some companies have done them.
Oh, yeah. Okay. Corporations.
Corporations have done them, so it's a big mistake. Any other questions?
I just have a comment.
Yes.
I started doing Tai Chi about 8 years ago, and it's really helped me because you incorporate the movement and your breathing, and balance has been a tremendous help for me.
Tai Chi is wonderful, and the thing that I like about Tai Chi, it's a nice fluid movement, so it's really soothing on the joints. It can be adopted into chair Tai Chi. I know that our local gym does Tai Chi, and I see people in there in chairs doing it all the time. And there is a lot of research out there that does show it's going to help calm you down. They do it with the elderly, and it's actually improved their balance, improved their strength, and lowered their stress levels. So it's wonderful, and you can buy tapes now. A lot of the gyms have them.
My mother took me to my first Tai Chi class, and she was 85. And she was the oldest one. We've got one man in our class that's 90. So, and he's doing great.
Yeah, and you can really build your lower extremity strength too. They've actually researched that, and people who do it, and after 4 to 6 weeks, will show an increase in their strength in their legs, which is good because that means it increases your ability to do your activities throughout your life. Any other questions? Okay, well, I have my email. On here, so if you think of questions, any other physical therapy questions, or want any other information, please feel free to email me, and just in the subject line, write scleroderma, just so I don't delete it. And so just remember, I am a scleroderma survivor, PH survivor, so I've been through all of this and trying to figure out with the exercising. How many of you have PH? Okay. So some of the things with PH when you're exercising is you want to make sure that you're not doing your arms and your legs together, because that can kind of flare up the pH, or any of the isometric exercises, which is the holding, the contracting and holding it. That can kind of raise the levels with the pH. But all of the other stuff we talk about with the water aerobics, the Tai Chi and the yoga is all safe for patients with PH as well.
What about that recumbent bike?
Recumbent bikes are great, especially if you have any hip or knee issues. We use those a lot for, especially after you had a total knee replacement. Anybody with hip or knee arthritis are wonderful. I do the treadmill and I do the bike. I'd stay away from the Stairmaster. That's a little bit too much for us. And the elliptical is also good for hip motion and lower back. And And when you're doing, if you're going to the gym or doing weights, it's best to try and do like 12 to 20 reps and exercise a lower weight, especially for pH, is to do 12 to 20 reps at one weight, and then when you can get to 20 reps is to increase your weight to the next one. Those are kind of the pH guidelines. Thank you.